Local News 8 continues to dig deeper into the case of Jeremy Best. He is accused of murdering his pregnant wife and taking his 10-month-old boy in Victor. Tonight, the community continues to ask the question, why? Which has led to a discussion about the increasing issues of mental health. Local News 8's Seth Ratliff continues looking into this and joins me now with more on this topic. Seth.
Well, Todd, today I spoke with a criminologist at the University of Idaho. Professor DeAngelis says that over the past 30 years, mental health crises calls have increased exponentially nationwide. That message was actually reiterated by our Bonneville County Sheriff's Department with information that might shock you. DeAngelis says mental health crisis and suicides make up about 20% of the calls that people make to law enforcement across the nation. But even in more rural communities like Bonneville County, it's shocking just how often sheriff's deputies encounter those same situations.
We're responding to mental health issues and suicide issues fairly regularly, once or twice a day on average, I would say.
When Jeremy Best was first encountered by the Bonneville County Sheriff's Office for public indecency, Sergeant Lovell says the responding deputies evaluated the situation based on the information available. As I first reported, Best did not have a criminal record or a history of mental health crisis. He also cooperated when the officers called an ambulance and transported him to the Eastern Idaho Regional Medical Center. Professor DeAngelis says Best's violent turn was uncommon and next to impossible to predict.
Generally, folks who are taken to the hospital and then sort of begin to compensate and become, act in ways that we would consider to be more normal when they're released. They may engage in violence, but it's profoundly difficult to actually predict whether or not that occurs.
And trainings for officers to deal with those experiencing mental health issues continues to improve.
We host academies here, once or twice a year. It's 40 hours of training that we try to send all of our deputies to so that they've got exposure to just crisis intervention type training, and everything that we do is this constant evolution of training.
Now, police and sheriff's departments still move forward with the criminal process while helping people get the mental health resources they're in need of, but they don't always make the arrest. Sergeant Lovell says even if they had initially arrested Best, it would have probably only been on a misdemeanor charge.
So taking all this information, mental health and whatnot, what does this mean in the context of the Jeremy Best case?
Well, Todd, according to Sergeant Lovell, that means Best could have been out of jail on bond that exact same day. Whether he was picked up by his wife or told to meet a judge another day, he more than likely still would have been out of jail having a mental health crisis and had the opportunity to allegedly shoot his wife.
Beyond this, you've been following this case from the beginning. You've been in touch with the Bonneville County Sheriff's Office. You've been in contact with Eastern Idaho Regional Medical Center. That's in Idaho Falls. What have you learned? Could this have been avoided by any of the organizations involved?
Well, Todd, according to everything we've learned from law enforcement, the hospitals, and now this criminologist, it looks as if the Sheriff's Office in Ermac did everything that they could and responded to the situation according to what information was available and what they had, and according to their requirements under Idaho law.
Okay, so the situation was very fluid and changed rather quickly. Okay, Seth, thanks for that report.